Hello everyone, this is Dr. Cui. So in this video, I'd like to introduce the occupational English test, OET test. This test is very important to us because it started from 2020. The ESMG used this test to replace the Step 2 CS test due to the COVID-19 pandemics. So apparently, it's very important for us to pass it in order to get the ESMG certificate. So for this test, it's a kind of medical English test, and in the listening and the speaking part, you will meet the people from different countries to give you the test. They're either from British, Australia, US, or India, so they have different accents. You have to get used to those different accents, especially for the IMGs who are from the non-English speaking countries like me. So we need to take some time to get used to it. And as I mentioned, it's required to apply for the ESFMG certificate. So it's very important for us to pass it in order to get the certificate. And the preparation time for the IMG is normally 3 to 4 weeks is enough. So so next I'd like to introduce my strategies to prepare each sections. For the listening part, I would strongly suggest to you to use the benchmark test. Here I give you the link. So I actually use a lot of practice materials, including E2 languages, YouTube's. Well, the benchmark is the most similar to the real test, I would say. And also, I would recommend you to change the speed to 1.3 times the normal speed, because in the real test, the speed is a little faster than the normal speed in the benchmark. But if you can handle the 1.3 times speed in the benchmark, you can definitely handle it in the real exam, because the real exam speed is definitely slower than the 1.3 times speed in the benchmark. And also I suggest you to practice 1 to 2 sets of exam each day. If you practice more than two sets, probably you will feel exhausted, and it's very low yield, and you have I just want you save some energies to practice other sections. So in the reading part, the part A is the most difficult part because the time is very limited. You only have 15 minutes to complete the whole part. And here I would suggest you to fill the blanks first and do the multiple choice questions last. And by doing so, you can save 1 to 2 minutes because even you don't have enough time to finish all of the questions. And if you leave the multiple choice question at last, you can just randomly pick up the answers. Well, if you leave the blanks last, you cannot just randomly fill the blanks, right? So in this part, I would suggest you to read take 1 minute to read the titles of each paragraph first, and then you will have a whole picture in your mind of this part, and then you can just do the question in the next step. So this may be this may be helpful based on my experience. So in the writing part, you probably will meet 4 different letters. Well, based on the official website, now it's only have 3 letters, including referrals, transfer, and discharge letters. And you need to pay attention to the most important information on the notes they give to you. So just pick up the most relevant information based on the requirement they give to you. and follow the template. Because every letter has a template, you need to know how to write the letterhead and how to write the end of the letter. And if it's a computer-based test, I would suggest you complete the head and end of the letter first to save some time. And because then you will have it. Then you can just focus on the body of the letter. And also, I would suggest you to use benchmark practice surveys because they can offer you correction surveys, and it's pretty cheap. And also, you can practice 1 to 2 tasks each day. For the speaking part, I would strongly suggest you practice by yourself first. You can just practice in front of the mirror, and you can either be the interlocutor and the examinee, and just practice by yourself. And normally, they give you 3 minutes to read the instruction first, and then 5 minutes of the conversation. So I would suggest you use the 3 minutes to read the instruction on both interlocutor and examinee's notes, and then just use 5 minutes to complete the whole conversation by yourself. So so after doing that, you will see that you have enough time to finish the notes in the real exam, because you only need to finish one part of the notes instead of 2. And also, after you get confident, you can try practice in a group. You can let your friends join the group, or you can lead a group for the practice. And for the OET mock test, I would suggest the service for the E2 language for their mini mock test. They will give you a score based on your performance. So and it's very helpful. And definitely you need to follow the templates to finish the task. And they normally give you 3 minutes warm-up time. So during this time, you can ask the interlocutor's name and or other information you think you are not sure. So don't waste this time. For example, if you don't know how to pronounce the interlocutor's name, you can ask him about that in order to save the 5 minutes conversation, 5 minutes in the real conversation. So during the conversation, you need to pay attention to those details. First thing first, introduce yourself and ask patient's name and confirm the patient information. And whenever you ask the questions, make sure that you ask each question one by one. Don't ask multiple questions. And whenever the patient shows some uncomfortable feeling, you need to show your empathy. And speaking of empathy, it's not just a word. You need to show it to your patient. You need to make sure that your appearance, your expression of that empathy. So don't just say that I'm sorry about that. You need to show that to your patient, and don't use medical terms like acute myocardial infarction, something like that. And you need to use a simple language like the chest pain or something like that, or the myocard, or the heart problems, or the death of the heart muscles, something like that. So use a simple language. Don't use the medical terms to your patient. And and also always ask the open questions. Open question actually can give you extra bonus for this test. And if you still have time at the end of the conversation, you can summarize what you are talking about and just go over again to the patient. So in order to make the best use of the time. And as I mentioned, the details make difference for this speaking part. Pay attention to those details and you will get a high score. I would say that the speaking part is the easiest part in this test. So just to pay attention to those details, you can definitely pass this exam. And here are some take-home messages. So in the official test, so in the official website, they offer three free tests. So use it smartly. Don't waste the tests. So take test one before the preparation in order to know your baseline, to know your weakness, and focus on those weaknesses. And after prepare for a period, improve your weakness. So you can take test two to see if you are good to take the test. If not, just prepare it again and take a step test three to see if you can pass exam. If you pass this, if you after talking, if you have done test two and you think you are good to go, you can definitely take test three to see if to double make sure that you can pass the exam. And for the passing scores, it's 350. So as long as you get 350, you can definitely pass the exam. And this exam you can take multiple times, as there's no record on your ECFMG account. So it's different, a little different from the USME exams. So there's no record for their attempts. So, but just a waste of money if you take multiple times. And the time for the result, for the release of the result is about 1 month. So if you are if you are time limited, so you may schedule multiple tests if you are not confident to pass exam, and in order to make sure that you can get your certificate on time in order to get matched in the next season. So that's all of the information I can give to you for this test. So good luck.